He has held various positions in the Global Health Organization, including serving as the Deputy Director General of WHO. He has made significant contribution to global health policy, particularly in areas such as disease prevention, health system strengthening, and emergency response. It is always a delight to introduce him. I think this is the fifth time doing that this year, especially. He's an expert, highly dedicated to improving health outcomes for all, and truly commendable. His work has had a lasting impact on the global health community. Ladies and gentlemen, help me welcome Dr. Anarfi Asamoa Baah.
Let me stand, otherwise you won't see me. Thank you very much, and welcome back. Uh, I'm being asked to moderate a relatively short session, and for lack of proper word, it's called a special session. But it's not very special. It's special in a way because it's a innovation that the organizers are introducing. Normally, during the opening ceremony, we hear some wonderful presentations, and today we've been privileged to hear some many wonderful presentations. But we don't create an opportunity for people to ask questions or comment or reflect because it's organized like a church service. People come and preach and we say amen. But some churches now you can ask questions. So what we want to do in the next few minutes is to give you an opportunity to comment on some of the interesting and important points that were raised by the different speakers. What we also want to do in this session is the last year has been very interesting, and we want a reflection from your perspective. What, in your perspective, were some of the highlights, some of the positive development on the NCD front you liked? We're talking about Ghana, but also some of the areas of concern, some of the areas that disturbed you, we need to take in consideration as we plan for the future. So that is what this short session is meant to do. First, an opportunity for you to reflect on the wonderful speeches we had, the keynote speakers, the address, the nice summary by the chairperson, the goodwill messages, the message from the Minister for Health, or the two speeches by Dr. Asamoa-Baah. The first one was his own, and the second one was for the minister. So you can comment on those. So now the floor is open for comments. Feel free. This is really to set the tone for the discussion. Yes. Can someone give him the microphone? And when you take the microphone, can you introduce yourself so that we know who is a sincere friend and who is not?
Thank you very much. My name is Ampoma Isaac, and I work with the Concern Health Education Project. I'm also a member of the NCD Alliance. I have always been a sincere friend, and so today I'm a sincere friend to Ghana NCD Alliance. I think the presentation throughout has been very unique. It has really exposed the gaps as I listened through. One of the things I would like to recommend is a dedicated fund, which I didn't hear from the presentation. We need some kind of an internally generated dedicated fund for NCD-related activities, especially the one that civil society can boldly enter through the Ministry of Health door and receive. So the dedicated fund, I need to hear more conversations around it. I also know that the NCD Alliance is doing a lot more in the area of taxation. It is raking in more funding. And so if some dedicated money can be used for prevention activities, some health promotion, which will also have a component of civil society that the NCD Alliance can tap. That will also go a long way. The last bit from the minister's speech where he mentioned about health literacy, I think it's also good. So if there will be a health literacy, then we also need the health literacy guide. Such document has to come out so that we can also learn from it and also mentor our peers. Thank you so very much, sir.
Thank you very much. Two good points. Funding for NCD and focus on health literacy. Yes.
Good morning, and thank you to the organizers for this lovely opportunity. I'm also a friend to the health sector. My colleagues in Ministry of Health will tell you, because their 8th floor is very airy and it's good for the health and very therapeutic. And it does. By the way, my name is Justice Oforelikem. I'm a business development consultant, but I trained as a health and depression counselor in the UK. And it's helping me in my consultancy, because all of us have stress problems in this country, but we don't accept it. And one word that Ghanaians don't want to hear is the word mental. As soon as you use mental, it's like you are stigmatized. So even if you are stressed, we don't want to talk about it. But I'm passionate about brain and then heart health. But one question I would like to ask, which I consider to be difficult but might be easy for Professor Akwisho say, is, sir, we've seen this chart on the smoker's body. So my question is, why do some medical doctors smoke? Because they are supposed to set examples for us.
Why do some pastors fornicate?
Thank you. I'm very happy for your counter question. This shows that they don't call you professor for nothing, like Azuma Nelson will say. Yeah. The other issue is that I'm a bit worried about our attitude towards healthcare. When we talk about healthcare, it is pro-West. So even the average Ghanaian doctor, I'm not a doctor, forgive me, the average Ghanaian doctor will prefer prescribing orthodox medicine for you than the synthetic medicine. Meanwhile, we have a very well-established facility in this country, Center for Plant Medicine Research. And they do their diagnosis scientifically. Look at COVID. When COVID came, we all started running back to neem tree and all those things. My other question is the third thing. I think, forgive me if there's a pharmacist here, I think there are too many pharmacy shops in the country. That is what is also leading to our health problems now. Because in the developed world, there are some drugs that you can walk to an over-the-counter shop in Ghana and buy. In Britain, they'll tell you to go for prescription. I remember, I didn't know that until I found myself in Britain. I was having some tummy pain. A medicine I used to buy in Ghana so much. And I said, oh, I walked to the shop, and this white lady looked into my face and asked me, this is a prescription drug. I said, what? What do you mean? And at the pharmacy shops in Ghana too, they don't educate you. I felt sad when I was sitting in a public transport, a lady who was coughing and had catarrh just swapped paracetamol in my presence, and I started using inhaler at the same time. But if you read the contraindications of medicines, when you take analgesic, you don't use other things because it will complicate it. So I think the health sector must also have a look at it. We should stop over-commercializing the synthetic medicines and then go back to the herbal, because that is part of us. God created the herbs too. But it appears even some medical doctors will even discourage you from going for herbal medicine.
Thank you.
Thank you.
Yes. So very good points. Too many pharmacies around. Not using our herbal industry enough. And when it comes to NCDs, we don't hear people talking about herbal medicine the way we talk about it. And any more comments? Yes.
Yes.
Yes, please.
Okay, so my name is Telana Gete. I want to ask a question relating to the youth.
Talk about the media you represent.
Youth Advocates for Ghana NCD Alliance. Okay, So I want to ask that, have there been any targeted educational programs aimed at promoting healthy lifestyles among young people? And what are the evidence existing regarding this effortness? And also, what are the steps being taken to address socioeconomic factors that may contribute to NCD risk factors among young population?
All right. So very good points. So one of the presentation talk about children being the future, and now he's saying the youth, and they are even underrepresented in this meeting. Nothing for us without us. Good points. Yes, I saw a hand. Yes, let's take two from here, then we'll have others react to some of the points that have been raised. And yes.
Thank you. My name is Esau Francis Kujo, a person living with diabetic, an advocate for Non-Communicable Disease Alliance. Yeah, you were when the UN, the World Health Organization lady was talking, she said emphatically that
You mean the keynote speaker?
yes,
All right.
it is cheaper to prevent than to let the disease come. But lack of education, lack of awareness, as doctor also said, lack of health literacy is a big problem. I was at the university. I was a graduate by then, but I never knew anything about diabetes. And I was caught pants down until I tested my urine to know it was sugary before I was even diagnosed. I've been to and fro the hospital for 6 solid months, and they could not tell me what was wrong with me. One, because they were charging for the strips, so when you go to the hospital, it isn't part of the regular OPD treatment that they will checks and balances that they will check to know that you are diabetic or not. You have to request for it and pay out of pocket, which is a big problem that is making so many people suffer diabetes in silence without knowing whatever is wrong with them. They give them other medications, they go and they come back to and fro. So that is one. So I'm very passionate about the health literacy. Is there a way? There are ways, not that is there a way, there are ways that we can get education on our health conditions, our lifestyles, and all those things to the people, starting from the children, from the younger age, by just basic things like putting it at the footnote of their exercise books and all those things. So I'm proposing, if it will be possible, since the World Health Organization is here, which is the mother umbrella for all health issues, the Ministry of Health is here and all those things, let's just get a team or something and let's think along this line so that we can get education on our health conditions to the children. The children will end up training their mothers, informing their mothers about the situation. And when they see somebody coughing or doing something, they may say, we read in the book that if you do this, it means this, so check this or check this. So that will be a checklist for us so that we can reduce prevalence and we can help in preventing than always waiting to do curative. Thank you.
Very, very good point. So one point that is coming through is health literacy. Some speakers call it education. And what is coming through is that, can we demystify so that it's not only for experts? Can we also democratize so that more people can talk about it? And can we start when they are very young, at the kindergarten level? That is when we should be teaching people about some of these conditions. You'll be surprised. There are even doctors who don't know some of these conditions because the basic things are not taught. When I was much younger, heart, you have to go to see a cardiologist. We need to demystify so that ordinary people can talk about it. Unfortunately, the people who are educating us about NCD are the people who are on the radio giving all sorts of adverts. We need to So that is one clear message or maybe recommendation coming out of this. Good points.
All right, thank you, Doctor. I'm Isaac Ampoma Benefo. I'm the Executive Director of Jaishi Youth Initiative. Jaishi, as in quit smoking. So what we do is that we sensitize the youth on the dangers and effect of tobacco smoking and any form of nicotine consumption. And I can say that seeing the smoker's body there, it sums up to certain lifestyles, alcohol, tobacco smoking, unhealthy diet, results in NCDs. And today, looking at this forum, I want to commend the Ghana NCD Alliance for this massive assembly and engagements. We are part of the NCD Alliance Global in Ghana. And this man have said everything I wanted to say. I speak for the youth with the lady. We have the NCD Child Global. I hope to see something like that here in Ghana, because speaking of NCDs, it starts from the youth, it starts from the kids. Mental health, it starts from the kid. And I want to recommend a certain word. In Ghana, I realize that when you use mental health, everyone thinks that you are mad. See, maybe if we can you can coin a term for it, maybe substance abuse recovery center, something for a rehab. When someone hears that you are going for rehabilitation, they think you are mad. All this stigma and perceptions, if we can coin ways to change it. Kids don't like it. Maybe we can use different terms for the generation coming. If we can coin certain words or languages, it will help us the things too. And I want us to leverage this meeting to having youth engagements. If we can also call youth stakeholders in this country, that either CSOs, stakeholders, anyhow, let's have a youth level engagement on NCDs in Ghana so that we can also pick it up from there. Thank you very much.
Thank you very much. So youth engagement is another recommendation that is coming through. But the other point he made is about, I'll come to you. How do we address stigma and address it in a more comprehensive way, including from our culture, even our culture, mental health. When someone wants to insult you, so about them. So we will not insult somebody to say he's got malaria. It's not an insult, but so we have a lot of work to do. So thank you for raising that point. Yes. The lady. We'll take two more, then we move to the second part. This was just to, all right.
Sorry. I'm Lydia from International Child Development Program.
Are you youth or not youth?
I'm youth.
All right.
We are tackling, we are concentrating, from all the presentation, I heard focus on prevention, and I think that is the right way to go. But in as much as we are looking at the side of prevention, we should also focus on early detection and management of NCD, so that the situation doesn't complicate before we seek help. And one major issue I want to focus on is the issue of literacy and education on self-medication. It should be noted. And I also want to ask what is being done to regularize this self-medication, especially the selling of drugs and medicine to people who just wake up and go to the pharmacy and get any kind of drugs. They wait until situations are complicated.
Good. So we all saying the same thing, but I think this confirms some of the points raised by the key speakers, but we've highlighted, again, literacy, youth involvement, how do you address stigma, financing. So we'll take the last comment, then we move on. Yes, we'll come to you. You will be the last.
Thank you very much. My name is Isaac. I work with Alliance for Reproductive Health Rights, and it's an advocacy group for women, children, and adolescents. So I picked one issue on data, and I think it's very important that we begin to look at data. And with data, I'm looking at the disaggregation of the data. And if you look at the issue with the renal unit at Kolebu, and I'm always asking myself, what does the data tell us? What is the breakdown? Which segment of the population are most affected? Is it young people? Where are they coming from? Because people are saying kidney issues are also linked with galamsey. Are they being recorded from the Western region? So if we don't begin to disaggregate the data to inform decision-making and research, then we might not make the necessary progress. So I want to find out from the Alliance what they are doing about the issue of data and disaggregation. Thank you very much.
Thank you. Very important point, data. We speak sometimes without data. So galamsey is not only in the Western region, it's all over. Yes, last point on this. Then the next phase, we want a reflection on the progress we've made. Yes.
My name is E.A. Kwatson from Susnet, Ghana. We are talking about.
Sit down.
We are talking about prevention, management, out of the end stage. Because in the end stage of NCD, you could be a stroke patient, you could be a liver or a kidney patient. Out of the end stage, what are you doing to help you who are in the end stage now?
All right. So he's advising us that, yes, everybody believes in prevention, but we also need to talk about management. We need to have a balanced view. It's not everything that we can prevent. There are going to be unfortunate ones who will have the disease. We should be thinking about their management till decent death. And sometimes we don't pay enough attention to that as well. So that is what he's reminding us. Yes, prevention is important, but unfortunately, there are some who have the disease now and will even have it in future. So we need to be a little comprehensive in how we look at it. The people are talking about prevention is because we focus a lot on curative. And that's why they are saying prevention. But we should not behave like the pendulum. We move to one end and then to the other end. We should look at the whole spectrum. Yes. This was the last one, but yours is the final one. Yes.
Thank you so much for the opportunity. So my name is Joseph Kobla Wemako, and I'm the founder and executive director of Human Rights Reporters Ghana. So I was really touched to be here, the things that I'm hearing. And I use that to just make a comparison. A while ago, I was talking to a lady friend regarding the kind of food that we take these days. I think these are the things that are contributing to the sicknesses that we are getting. For instance, talk about our local food, gari. People see gari as it's a poor man's food. The moment they start making money, then gari is no longer in the picture. But I was telling her that gari is something very, very important. And if you are eating gari, all the sicknesses will be away. And so I'm advocating for us to eat our homegrown local foods. And also we should be honest. Most of the industries, the companies that have come, they are bent on what? Making profits. And they are destroying us, they are killing us. So the doctors, the advocates, health advocates, all of us should be able to speak up to this and let people know that, look, if you are taking this food quantity, or you even stop it, yes, we will destroy the business, but we are protecting our health, and it is important we do this. Thank you so much.
Thank you. Thank you for the advocate for Gary. I noticed much earlier that Prof. Kwesio say is not a fan of neat fufu. So he's raising the point about our diet. Whilst we're talking about NCD, we should be now focusing on what are the cause of the causes. So our diet, our environment, and the other factors. Good. So before we hand over, we want just a short period where we can reflect on what progress we've made the last year. What are some of the things that made you happy in the area? So let me start with my own. I think last year, or the last year, we have seen increased visibility on NCDs. Now everybody knows about breast cancer, the days that were celebrated. So the awareness about NCD is growing. And I think people are also getting used to the idea of screening. Ghanaians like screening, medical screening. Now even politicians have taken over medical screening as a strategy. So that, for me, is the positive part. But of course, there are many, many negative parts. So we want to hear from you. First, what are some of the things the last year that gave you hope that Ghana is taking NCD a little more serious than we've done in the past? Then we'll spend the last time on what are the challenges, because that is what this workshop is about. But now let's start with some of the positive things. Anybody want to be positive? Yes. Yes.
Okay, I would like to talk about the Ghana food-based dietary guidelines. Also for our information, maybe people who are not aware, Ghana has a dietary guideline that is country context specific. So it is online, we can all have access to it. Like he said, the gari, in eating the gari, we will know the quantity we have to eat and all other foods that we have to eat. Thank you.
All right. So for the first time, Ghana has developed some guidelines. So that is some improvement. Yes. Most people don't eat gari, just gari, wache, egg, willy. Yes.
Yes, I believe that, like you said, a lot is going around with respect to addressing NCDs in Ghana. And I am more excited. It's not a very good example, but I'm excited that at least we have an amendment to address sugar-sweetened beverages. Usage, because it's one of the key things that are really, really, really affecting us as Ghanaians. And we hope and pray that this would go on. There has also been quite a lot of data that is being gleaned around the legal and policy issues. And we realize that we have a lot of gaps. But at least something has started, and we believe that that would work. Also, the FDA is also trying to amend some aspects of its policies, and that would inure to having a positive food environment for Ghana, which is very important. Thank you.
Good. So, good movement on some of these so that we can address the open advertisement of Indomie, Calipo. Yes. Now, can we move to the one positive, then we'll end with the negative and the things that worry us still.
Thank you very much. I just want to reflect a bit on mental health in Ghana. In the past 1 year, it's good to note that in terms of media interest and reporting in mental health have increased. Back in the day, you'd be chasing for media people to come to a program related to mental health to cover it, and they will leave it and be elsewhere. But now we have international days like the World Mental Health Day. Media platforms are calling various stakeholders, NGOs, CSOs, the Mental Health Authority, just to speak to issues related to mental health. And I think that it's very worth reflecting on. It means that there's an increased awareness around mental health. We also have increased number of CSOs springing up across the country. Back in the day, you mentioned mental health in terms of CSO, and basic needs, mind freedom, and a few others were noted. But now we have a whole lot of CSOs coming in to help, and the Mental Health Authority is also being very helpful in terms of coordinating all of these stakeholders in mental health, and I think that it is worth commending. Thank you.
Very good work. So mental health awareness is increasing thanks to advocates and other events. If you listen to Antina or Abna Koko, they are all helping to raise the importance of mental health and the fact that most of us are sick. I always say the percentage of Ghanaians who have mental health is very high. I mean, normal Ghanaians, not politicians. They're normal Ghanaians, yeah. Yes. Good. So now we wanting you to also reflect on, from your perspective, whilst we have these encouraging developments, what are still the big issues? And don't repeat what you've said, so nothing about financing.
Yes, Director, thank you so very much. I think, reference from the last conference, with the success is that we've been able to advocate for the amendment of some taxes. So there is the health tax, sugar sweetened beverages, which of course, I cannot forget money, has increased the portfolio. That is why I said we will need a portion to be doing more of these programs moving forward. So that is what I had wanted to come in. But the gap, based on the question you asked, is that we also need more political will. I think we need to engage all the political parties in future, including the butterfly, so that we'll be able to advocate more and push forward. Thank you, sir.
All right. So he's pushing that now that the political parties are going to draft their manifestos, it will be useful we push them so that NCDs appear at least in their manifesto. Whether they will implement their manifestos, another story, but at least it should appear in their manifestos. Good, good, good. Yes. Yeah.
What I think that we should do that we've not done is that this is not the first time I'm hearing that people go to keep fit, they sweat, and they end up with ice chest. And I don't think this is going to be the last time I will hear this. But what I think
for some of us, that's why we go to keep fit.
Yes. But I can assure you that 10 out of 10 who go to keep fit go there because of health issues, to trim down and develop in their health systems. What they require is us meeting with them. So what I've noted that this community that's keep fit here, I go see their chair that tomorrow I'll be visiting you from NCD to come and talk to you on one or two issues. They want to hear it. And I believe that if we start this thing, we'll have a reduction in the ice chest that get open after keep fit. Thank you.
So he's advocating dry keep fit. All right, so we'll end with our consultant who started with.
Say, I'm not coming on a more positive note so that you not give me a counter question. I think the healthcare or health literacy is becoming more gender balanced. Because previously, I'm not being biased. I have a daughter, so I'm not against the women. The health literacy, most of it, one that was highlighted so much in Ghana for years was this breast cancer and cervical cancer thing. But I think in recent times, they are emphasizing on prostate cancer. And I think this year there was free prostate cancer screening, World Prostate Cancer Day. So I think it's good and we have to keep it up. So it's also one of the good things that NCD is doing. Thank you.
All right. This is one area that I think the health industry is really helping to shine some light on prostate cancer. So the point he's making is in the past, maybe largely due also to Dr. Wiafe's effort, there's a lot of focus on breast cancer. And we need to move where we are looking at holistic, not even selecting some particular cancers, because otherwise we get to the stage where if you have a rare cancer, nobody really looks after you. And everybody is talking about leave no one behind. So it's not only those common conditions, but even the uncommon conditions, we need to be shining light on them.
Okay, so I would look at what we need to do.
Yes.
And looking at how we plan our cities. So our urban spaces have become so congested, so unorganized, and it becomes very difficult to even plan your life. And I think as countries begin to move towards smart cities, as a country, we should also begin to look at that. Even if you wake up in the morning and you want to walk around, there are a lot of challenges with street lights, with security. So if we don't plan our cities very well, it poses a challenge to prevention of STDs and health promotion as well. So I don't know whether in this platform we have the assemblies represented, because it is their core responsibility to plan those spaces very well. So I think going forward, we should involve the assemblies well in our advocacy as well. Thank you very much.
Thank you very much. So as I said, this was just to provide an extra opportunity for us to elicit additional comments, and we've really endorsed. I want to end by really thanking the NCD Alliance. This is a national high-level meeting. One would have expected that this will be organized by the Ministry of Health, and all of us will go around it. But it's been the other way around. An NGO